lifetime prevalence of low back pain is almost 70 to 80%. The chances of someone having low back pain in their lifetime is as high as 70 to 80%. Young individuals have started experiencing low back pain these days. What are the causes? What if I tell you that there are a few things that if you try to incorporate in your daily lifestyle, make a few changes, you can stay away from back pain or lower the chances of you having back pain. Let's talk about it. I'm Dr. Rakesh, Dhake, working as a consultant spine surgeon in Mumbai, having worked previously in the UK as a consultant. The first thing I would like to talk about is prolonged sitting in one position. You might have heard the saying that sitting is the new smoking. Why do they say so? Let's look at it closely. When you sit like in this position, the intradiscal pressure, meaning the pressure in the intervertebral discs, the cushioning structure in your spine, the pressure is the highest compared to in any other position. Like when you are standing or when you are lying flat, compared to those positions, the pressure in the disc when you are sitting is the highest. Now it's obvious that if you are sitting for a long time in one position, you are subjecting this discs to a continuous amount of high pressure. So if this is what you do every day, there will be a time when this discs will start having problem. The way to deal with it is to not sit for a long time. Now you might say that, doc, my job involves sitting in one position for a long time. I'm an IT engineer, I do desk job, I'm a coder, I'm on computer all day long. So the way to deal with this is to take frequent breaks. So you should not be sitting in one position for longer duration of time. Like every 30-40 minutes you should stand, you should walk around a bit. If you can do that job in standing position for a few minutes, then you should do that. You should do a few stretches every few minutes and then go back to your work on the desk. The other thing is to make sure that the chair you are sitting on has got adequate back support that keeps your back in straight position. So if not, then you can just attach an extra back support on the chair so that your lumbar curvature is in a natural position. Other thing is to not slouch when you sit, not have a lazy back or slouch forward. So for that matter, to give an example, I am a consultant spine surgeon myself and I see patients in our outpatient department. Like we are in one position for hours and hours. So the way I deal with it is after I see one patient, I might do a bit of standing consultations, go to the examination table, do the examination in standing position and then come back to the chair. Between two patients, I do a bit of stretches. So that is how you should be doing as well in your job. The other thing is if you are riding bike to go to work, then you should avoid riding that for a long time. So try and take few breaks. If there is an alternative solution to that, then you should explore those options as well. The other thing that we commonly find is guys especially have wallets in their back pockets, and if this wallet is thick, then that just puts a little wedge on your sitting position and you tend to sit with inclination, like one side goes a little higher than the other, and in doing that your muscles in the back are acting inappropriately on both the sides to balance you. So that is something that you should make sure that you take out your wallet or you keep it thin so that your back muscles are acting equally on both the sides and you don't strain your back. The other thing that we commonly see in office going crowd is having their office bags on one shoulder, especially on guys. Like they will have heavy bags on their shoulder, and these bags sometimes can be so heavy that your neck muscles or your shoulder muscles can go into spasm or can get strained excessively, and the other side of your back has to do extra work to balance you and keep you straight. So make sure that if you are using shoulder bags, then these bags are not very heavy and have lightweight, or if you can use another bag which has straps on both the shoulders and equally balances the weight, then that is advisable. The other thing that we see in ladies commonly is to use high heels. Well, there's a fashion, and why not? If you feel confident, if you look good in high heels, then you should wear. But the thing that you have to be aware of is high heels does put excessive amount of stress in your extensors muscle of the back. Your glute muscles, your hamstring and your lower back extensor muscles are at excessive stress. I would recommend that you don't wear heels for too long, or if you're wearing them, then you don't walk on them for too long or don't stand on them for too long. After you remove the heels, then you should do some exercises for your feet, stretch them, rotate them, and just make your feet supple after you remove heels. The other common thing that we see is lifting objects inappropriately from floor. Now this is a thing that we do so commonly in everyday routine, like when cleaning the floor, or if you're just picking an object from the floor, then you just end up arching your back, you bend and you just pick it up and you stand. We don't even think what we are doing to our back. So what happens in this activity is that you arch your back and you put excessive stress on your discs and on your spine, and this may cause disc-related problems. So that when you flex your back or you arch your spine, the pressure on the back side of the disc builds up, and that can cause disc-related problems. So you have to make sure that when you have to pick up something from the floor or you have to bend, you don't bend in your spine. You keep your spine straight and you bend in your hips and your knees. You squat, you sit down, pick up the object, and then stand again, rather than arching your back and lifting the object straight away. So this is very important. The other thing that we commonly come across these days is using phone. If you see train station or in any public places, everyone is on their phone. The screen time has increased so much so that neck problems have increased as well. When the use of phone increases, most of the time we are looking at the phone with bent neck in this posture for a long duration of time, and that puts excessive stress on your neck muscles as well. So try to reduce that time, try to take breaks in that as well. If you have to use phone, use it at a reasonable height so that you're not bending your neck excessively. So that is also something that you should remember. The other thing that we commonly get asked is sleeping habits, like what should be the quality of mattress that you use in your bed, whether it should be soft, whether it should be hard. Let's talk about that a bit. A very hard mattress or a very hard surface, if you sleep on, it has been found that the quality of your sleep can get compromised. And if you're thin or slim, the bony prominences might not have adequate cushioning, and that can cause pain as well. A very hard surface is not advisable. If your bed is too soft, then it does not really go along the curvature of your spine, but it excessively lets your spine sink into the bed, and in doing that, it may twist, it may cause excessive stress on your joints and your ligaments or your muscles. So in the night time or when you wake up, you might experience back pain. This is because of the excessive twisting of the structures of your spine. So it should not be too soft either. It should not be very hard. It should not be very soft. It should be something in the between, like a firm surface is what is advisable. Now, when you get into the bed, you should sit on the edge of the bed first. Then with your hands, you should sleep on one side and then go to supine position if you want to. When you get out of the bed, again, you should go on one side first, use your hands, get upright, sit at the edge of the bed, and then get out of the bed. So this is how you should get into and out of the bed. The other thing is about the pillow that you use when you sleep. This is also one of the common questions: how tall should be the pillow, whether we should use or whether we should not. Now, I would say as long as your pillow is not too tall, as long as it is reasonable in height, then it's okay to use a pillow. So it should not be so tall that you have to flex your neck, and it should not be so thin that when you sleep on one side, your neck is excessively stretched. So it should be just in the right amount and right cushioning that gives you comfort. So using pillow is not bad. It's just the height of the pillow that you should be aware about. The other common thing that you should watch out is weight gain. Now, if you are on a higher side of weight and your core muscles are not strong, then I would recommend you work on your core muscles, which are your abdominals, your trunk muscles, and your back muscles. If these muscles are strong, they can act as an internal brace and support your spine, and that can also reduce to some extent the incidence of having low back pain. So it is obvious, like if you have more weight in the front of your body or overall through your body, your back has to do extra work to keep you upright. So your extensor muscles have to do extra work to keep you upright. So if you lose a few pounds, your back will thank you. Your back will be happier if you have less weight to carry. So try and do that. Stay active, exercise, and try to lose weight. So these are the few things that we commonly come across and do in our daily routine. And if we do a bit of changes that I suggested, I'm sure that you will prolong the incidence of having low back pain, if at all you would. I hope you enjoyed this video, and whatever tips and tricks I told you, you will try to include that in your daily routine, and that will help you stay away from low back pain. With that, now I'll take your leave, and I wish you a very healthy spine. Thank you and goodbye. Cheers.